Hi, Dr. Gator. Welcome to the show. I'm very excited to have you back on.
Thank you for having me back. I'm excited to chat again.
Yeah, so it's been about 6 years since we discussed health for children, integrative pediatrics in 2020. It was the COVID pandemic. It was crazy. It was a pretty crazy time for all of us. And I remember being like, oh, an integrative pediatrician, I want to talk about vaccines. And before we started recording, you were like, I don't really want to cover that topic publicly. I'm like, okay, fair enough. And here we are, 6 years later. You wrote a book about vaccines. Tell me what changed between 2020 and when you published your book, Between a Shot and a Hard Place.
Yeah, I mean, back then, it was just so difficult to talk about vaccines. I mean, I was on a bunch of podcasts and shows, but ultimately, the people that were speaking about it were just having their platform shut down and just really getting in trouble and losing their licenses and all sorts of things. And so I just really decided at that point that I wasn't super comfortable doing that, given all that would come with it. But really, with the pandemic, I just got more and more frustrated, and there's just so many things that just didn't make any sense, and it became extraordinarily frustrating for the fact that I could talk about this in the office, but really
Mm,
not anywhere else. And
mm,
so I decided that I really need to get educated in this topic as much as possible before I write before I talk about it. So that's what really led me to write a book, so I could really dive as deep as possible, so I could at least be as educated as possible. If I'm going to talk about this crazy topic, then at least I'm coming from a place of as much knowledge as I possibly could gain.
mm.
And I think luckily over the last couple of years, things have changed somewhat, where the world's a little bit more open to talking about these topics, and censorship has really decreased, which is great. And so I've been able to have lots of conversations about vaccines, and it's been great so far, and really very few issues or anything like that. I think people are much more open to it, and they respect nuance, and they really want more of these conversations. And so it's been really nice to be able to actually do that and talk about it more.
Oh, yeah. I think one of the blessings of the pandemic was definitely opening up this type of dialogue to questioning personal medical freedom being limited and kind of prohibited or infringed on, especially in the United States, where we pride ourselves on democracy, as well as just people are like, why is the government telling us how to take care of our health and our children's health? Like, shouldn't that be an individual choice?
Yeah, and that's my belief and has always been my belief. We're trained in educating patients. I mean, it's not supposed to be anything forced. It's not the CDC forced schedule. It's the CDC recommended schedule. And that's really the way that I think we should be practicing. And that's the way that I practice in my office. We have vaccines. We offer them for those that want them. And we have patients that do the regular CDC schedule. Some people do a slow schedule. Some choose not to do it.
Hmm.
And ultimately, I think our job should be to educate, to recommend, to inform, and to help people to make the best decision for them. And it just seems like we've moved really away from that towards kind of more forcing and telling people what to do as opposed to educating them. Even if you disagree on a decision, even if you feel very strongly that everybody should get all the vaccines, at the end of the day, it should be the family's choice of what
Hmm.
they're going to do for their family, what you're going to put in your own body. And that's what I wish we could get to. I think if we could get to something like that, then the temperature around vaccines would decrease a lot.
So, yeah, exactly. I love that in your practice, you're able to really understand what the patient's need is, which is your pediatric patients, and what the family is looking to, what their outcome is for health. And then you're able to provide informed consent, which I think is so important. Do you want to delve a little bit into informed consent and specifically, in regards to vaccination?
Yeah, that's the foundation of medicine, right? We're supposed to be giving informed consent. We're supposed to be giving as much information as possible to help people make the best decision for them. And with almost anything in medicine, we try to do that, but it seems like this one topic, it's off limits, or it's like, oh, just the vaccines are safe, they're effective, just go do it. And we don't get a lot of informed consent when it comes to vaccines. I think the discussions often are very short. Parents don't have all the information. You'd have to go read long books and really have lengthy discussions to even begin to have informed consent with something like vaccines. And so I just don't think that parents realize that what they're getting in the office is really not informed consent. It's just kind of the very basics of information, with the assumption that you're going to do it. And I don't think that's the best way forward. I think that's decreasing trust. I think that the fact that we're not having these discussions, we're not giving people all the information, doesn't mean people wouldn't vaccinate, but I think we owe it to ourselves and to our families and to our kids to really have these discussions, to look into the risks and the benefits, to be able to help to make decisions for ourselves and ultimately for the future of the vaccination program to be able to make it better and safer and more effective. If you can't have those conversations, if you can't work to make it better and safer, it's never going to be better. I mean, we shouldn't be so arrogant to think we have the best vaccination program we're ever going to have in humanity. Like, we can always make it better. We can always make it safer. And it just seems these days like, oh, no, they don't cause that issue. No, they don't cause any problems. They're just safe. And that just can't be true, that there are risks to everything. And I think there are more risks to vaccines than we acknowledge. And I wish that we would work to try to figure out those reactions, who's susceptible, what are the genetics, what is the reason, and so that we could maybe figure out who are the kids that are most susceptible, who are the kids that shouldn't get vaccines, who are the kids that should space them out. That's a possible thing that could be done. Or maybe there's a way to make vaccines safer, like a different format in the future where, we can acknowledge that, yeah, maybe 1 in 100 or 1 in 1,000 kids have a serious reaction. Maybe we can decrease that. Maybe there are ways around that. If we change the format, we make it into a drink. I don't know. There's so many things that we could do if we acknowledge the problems that might be happening. But until we acknowledge the potential risks, we're not going to make it any better. And it just seems like the only conversation is, how do we get more vaccines into more people? And soon enough, we're going to have 100 vaccines, and you're going to be walking in your office and getting 20 shots at one time. And there doesn't seem to be any pushback that there could ever be too many. And no matter how good something is, whatever you believe, there's always too much of a good thing. And so with vaccines, I think we're getting to that point where the question is, how many shots is okay? How many shots can you get in a visit? How many shots can your body handle? How many shots are okay in the first 2 years? When does it become too much? I think that's a reasonable question for parents to ask.
Oh, 100%. And, when we're talking about infants and toddlers and their tiny little bodies, tons of, like you mentioned, tons of vaccines at one office visit could be so overwhelming to their system. We know that there's heavy metals and other chemicals that are found in the vaccines, that are adjuvants to help create that antibody response. But that's also something the body needs to detox, right? And if their detox pathways are not working as well, or the load is too high, we're going to see potential side effects.
Yeah, I mean, that's how anything is. You get enough of anything, it could be dangerous. And for certain people, even very tiny amounts can be dangerous. It's like some kids walk by a peanut and have an anaphylactic reaction. Peanuts are not dangerous to everybody, but they're dangerous to some people. And there's no reason to believe that a bunch of chemicals in a vial injected into your body couldn't have some side effects for some people. I mean, of course it does, right? And I think that we don't fully comprehend the complexity of these reactions. We say, oh, just 1 in a million. Well, right, 1 in a million of a reaction, but there are many different kinds of reactions that you could have. So if you have thousands of different possible 1 in a millions for each vaccine, all different autoimmune conditions and heart issues and lung issues and liver issues, whatever it is, even if each one is 1 in a million, you add those all together for each shot, and then you multiply that by 20 shots or whatever you're going to get over the first year. That risk of a serious reaction to one of those vaccines, one time to one sort of reaction for you, it's not 1 in a million anymore. It's 1 in a few hundred or 1 in 1,000, whatever it is. I mean, it's impossible to calculate. But the point is, there are many possible reactions, and that's where I think that we go wrong in medicine, because it's just 1 in a million. Right? Each one might have a very small risk that you will get an anaphylactic reaction or a seizure, but you add them all together when you're having so many vaccines, and there's a real risk there. It's still, most kids, I think, do fine with vaccines, but when you're talking about numbers where it's 1 in 100, 1 in 1,000, whatever it might be, when most of the diseases are quite rare, that is what we need for parents to be able to help them make informed consent. You still may very much be like, well, you know what, I understand there's this risk, it's 1 in 1,000, but I don't want my kid to get measles, I want the measles shot. Okay, great. Like, that's the whole point. That's informed consent. You're trying to provide the best information so people can make a judgment call. And I think the easiest example of that is hepatitis B for a newborn. Right? Because if you have hepatitis B as a mom, your kid has a very high risk from hepatitis B. So most people, regardless of what the risk is from the vaccine, are going to be like, yeah, you should probably give your kid that vaccine. There's a huge benefit there. And I'm sure there's a small risk, but there's a huge benefit. But if you don't have hepatitis B, then you have an extremely low risk for your baby. So maybe the benefits of the vaccine don't outweigh the risks from the vaccine to a healthy baby that has almost no chance to get hepatitis B. It's not zero. You could get hepatitis B in theory, but the risk is so small. But that's the point. That is, at least in my mind, the point. You're supposed to be given that information so you can weigh those in your specific situation and make a decision. There's nothing anti-science or anti-vaccine or crazy about that. That is science. That is
Right.
that is informed consent. You're supposed to be getting that information so you can make a weighted decision, not forced to do something. You may say, well, I don't want measles. I think the risk of measles is really high. I'm going to get that vaccine. I'm not so worried about polio because there hasn't been a polio case in 40 years. So maybe I'll wait or not give that one to my kid. Hepatitis B, well, there's a 1 in a million chance my kid get hepatitis B. I'm not so worried about that. I'm going to hold off on give that later, when they're a teenager or whatever. Like that, those are the kinds of decisions that I think people should be allowed to make without judgment.
Yep.
And you may be right, you may be wrong. Everything about parenting and life is about making decisions, and you could be wrong. You could not give your kid hepatitis B, and they could be the one kid that gets the disease and gets really sick and dies. That's possible. That's called parenting. I mean, but at the same time, you could give a kid a vaccine and they can have a reaction. So to me, our job is to give information and to help parents make the best decision at that time. And they could be right, they could be wrong. But our job is not to make that decision for you. It's to provide that information so that you can make a judgment call. And that's not what happens with vaccines. It's basically forced upon you in most places, or, essentially forced upon you in many
Yeah.
places. And that's not right, I think.
100%. I mean, so there's a couple things that you covered. So let's say it's a parent's following the standard schedule, and it's multiple vaccines given at that one visit. Maybe it's a 2-month visit or a 4-month visit. And we don't also, as far as I know, there's no studies to show how all of those ingredients in the multiple vaccines shots interact with each other in that one, the exposure, right? That patient is getting the exposure at that one visit. We don't really even know how those interact and potentially the risk that come with having multiple vaccines in one session.
Yeah, I mean, and that's why I think it's really important for parents. They do have to go and read some stuff about this. I think you need to understand what the research that has been done, what's out there, and how things have been studied, because it's not all that intuitive. I mean, even for me, somebody who's been involved in this, until I did really the research, I didn't really realize how research worked for vaccines, what research we actually had. I certainly thought there were more different studies than we
Mm-hmm.
actually have. And so I did, really try to go through that in the book, Between a Shot and a Hard Place. But I mean, essentially, most of the best research that we have is going to come before a vaccine hits the market. It's done by a company. So obviously there's bias there because it's for their own product. They generally study that product itself, maybe with a couple of other vaccines, but mostly you're studying that product in isolation, studying it for safety against another vaccine, maybe an earlier version of that vaccine. You're studying it for a couple of months if you're lucky. It might be a few days, maybe a few months, a year if you're lucky, but they're not studying it for years. So we don't really know the safety profile when you combine them all together, because that's just not how it's studied. And we certainly don't know if it affects you long term, because that's not how vaccine research is done. I mean, you have some retrospective studies looking back, but they're not the best and they're inherently biased. But the prospective, the studies looking at vaccinated versus unvaccinated, how a vaccine affects you long term, if it increases your risk of cancer 10 years from now or some sort of autoimmune disease, we don't know. We just assume that it doesn't, but it's not studied like that. And so we say, well, we don't have any research to show that it does, which is true in general, but that's just because it wasn't studied that way. So it doesn't mean that it doesn't. It doesn't mean that it does. But even if something increases your risk of an autoimmune condition 1 in a million, there are a lot of different autoimmune conditions. If it increases your risk of different kinds of cancers 1 in a million, 10 years from now, well, all those things added together, again, that's a real appreciable risk. And so we don't even know if that's true. It could be 1 in 1,000, 1 in 100,000. Maybe it doesn't affect it at all. I don't know. That's why I would like the research.
Nobody knows, right? Yeah, nobody knows. And we want to know, like as parents, we want to know, how is this going to impact our child 10, 20, 30, 40? I mean, these are children that have decades left, ideally, of their life, right? So how is it going to impact their lifespan and their overall health and wellness? Like that's the question that parents want to know. And if they choose not to vaccinate, what are the risks with that as well, right?
And can I say that medicine always focuses on the decrease from the specific diseases. And that's important. I mean, I think that we have very good evidence that for the most part, vaccines do decrease your risk of the specific disease. So for example, measles, most kids that get measles are unvaccinated, right? That's just the reality of it. The vaccine works in general and works pretty
And then they
well.
have natural immunity for the rest of their life.
Yeah. So, I mean, there are different arguments there, but let's just say that on the very basics, medicine generally argues, well, if you don't get the vaccine, your kid's going to die of this disease or get really sick. And that's why we need these vaccines. But they never discuss the risks from the vaccines. You only get the one side. And the benefits in general, let's just take the mainstream argument, they're real, right? You get a decrease, you get immunity to the diseases, let's say for measles, and your risk of getting measles is much lower. That's there, but that's not the whole story. And that's not the question that parents have. The question parents have is not, does this vaccine protect my kid from measles? It's, what are the risks from the vaccine and how do we weigh that against the potential benefits? And you can argue some of the other stuff. We don't need to go there. But let's just say on the very basic level, is that benefit from the vaccine worth it for me in the setting of what are the risks from that vaccine or from multiple vaccines? That's the question. And that's not the question that medicine generally asks. They just say, well, we know the vaccines work. You don't want your kid to get measles. If you don't give this, then everyone's just going to get measles and die. That's only half of the discussion. And that's where medicine fails and why parents are getting so frustrated and why I think more and more people are choosing not to vaccinate because they don't feel heard, because it's not just about disease prevention. Yes, you'd want to decrease disease, but the question is, how does that affect you long term? How does that affect your immune system? How does that affect everything else? Because if you decrease your risk from, let's say, whooping cough, but you increase your risk to every other disease and your risk of getting chronic conditions and maybe getting more sick from some other disease, yeah, you have a low risk of dying from whooping cough, but you might have a much higher risk overall of dying from something else. That's a reasonable question. You're not supposed to give something. You don't give a pill to somebody and then increase the risk of getting cancer and die. Like, you want to decrease their risk of whatever they have and also not increase their risk of something else too much. So that's the question that parents have. I don't have the answers because it's never been studied in that way. We don't have vaccinated versus unvaccinated prospective trials that we need to really answer that question. And so a lot of the answers should really be, I don't know. And that's why it shouldn't be forced. You should be giving people the best information that you have and then having discussions about it and letting people weigh that information for themselves and deciding if they're comfortable with it. There should be nothing wrong with that. Just like with surgery or cancer medication. I mean, cancer medication is a perfect example. We know there are risks to taking chemotherapy, right? Like,
Right.
you know, if you have cancer, like, your hair might fall out. It might destroy your immune system. You might get sick and die. Like, that's a part of chemotherapy. You may choose to do it. You may choose not. It may save your life and you may get rid of your cancer. Okay, you understand those risks, but you also might die.
You
And
might die from the
from
intervention.
the
Yes.
intervention, you might die from the intervention. You might have 5 years left from your cancer, but if you take the intervention, your immune system goes down. You die of some cold next week. Like, that's possible. And we explain those risks. And some people say, you know what, I don't want to do chemotherapy. I don't want those risks. I'm just going to live out my life and take those risks. And other people are like, no, I want to do everything possible. I understand there's risks. That's medicine. The same thing should be true of vaccines.
Yes, exactly. And, my practice is in New Jersey. So, this is a state that we do have religious exemption, but bordering states, Connecticut, New York lost it a few years ago, along with, I know, California, where you practice. And it's interesting, when you practice in a state where there's religious exemption, and then like right across the river, there's not religious exemption in Manhattan. It's, it's just an interesting way. Like, that can also help, not help. It kind of forces parents to make a choice around vaccination that they might have made differently because of not having this medical freedom to be able to choose if they want to send their child to school or camp, for example.
Yeah, I mean, to me, it's so frustrating. I live in a place where it's essentially you're forced to do it unless you want to homeschool.
Right.
Uh, and again, that just doesn't make sense to me that we would tie school to vaccines. Like, I understand, I understand the theoretical public health reasons, but realistically, kids are going all sorts of other places. They're going to the store, they're playing sports, doing all sorts of other things, but we just tie it specifically to school. And the argument is we just, I guess, need to get everybody vaccinated so you can protect the other kid. But most places around the world, most of the states in the country don't have requirements. They have exemptions if you choose to do it. And it's not like they're just huge outbreaks everywhere and everyone's just falling dead of vaccine preventable illness. So I just don't think you need to force it. I think most people choose to do it and that's fine. And for the few that don't want to do it, they should have that option and you should have that religious or personal belief exemption. And that's fine. It's not that many people and that's what they're choosing to do. And, if we have massive outbreaks and everyone starts dying left and right, well, maybe we'd have to revisit that. But that's not what's happening. And so I just don't think there's a need to force people to do something. I think you can educate and you would, again, decrease the temperature on this entire discussion. If you just didn't force people to do it, those that didn't want to do it, don't do it. And just leave it at that. I think people are just so worried, especially now after COVID, and rightfully so, that they're worried that the next outbreak's going to happen, the next disease is going to come. We're going to be forced to do another vaccine and something different that you really don't want to do, that's even more deadly, that's more problematic. We just, once you start to force people, it's a very slippery slope of what you can force in the future.
Hmm.
And or you say, we're not going to force anybody to do anything, we're going to offer things, and we're never going to force it. Those are the two different options you really have. And right now we're moving down the slope of being able to force things, and that's we're seeing that happening more and more. And it certainly happened during COVID, and it happened around a lot of bad information. I mean, a lot of things that were told just didn't end up being true, and yet it was forced around some of those facts that didn't end up being facts. So that's why I think it's really important that we continue to fight for medical freedom. So that way,
Yeah.
in the future, if an outbreak happens and a new vaccine or new medical product is brought out, you just have the option if you want to take it. I mean, we can't
Yes.
know long term something new. That's fine. Like, nobody knows if you're going to get myocarditis in the future. Nobody knows what the future holds for a new product. That's okay, but you just shouldn't be forced to do it. You should have the option. If you choose to do it, you take those risks. That's fine. I mean,
Yes.
that's there's nothing wrong with that, and I don't think there's anything wrong with them bringing out the COVID vaccines. I think there's something wrong with forcing it. I think if you wanted to take it, if you were high risk, if you felt the benefits outweighed the risks, you should be allowed to do that. But you just shouldn't be forced to do it to go to school. Um, so that's where I think we really went wrong. You know, the main thing we went wrong in the pandemic, and what I would
Yeah.
hope different in the future. And it seemed like we were moving in that direction, but now I'm not so sure anymore. Seems
Mm.
like we've gone back again.
Ugh. Well, it just reminds me of, those religious exemptions were removed before the pandemic, shortly before. And I do feel like it was setting the stage of, if this is what's forced, so to speak, for children to have to receive, unless you want to move out of state and or homeschool your child, which is not a great option for a lot of working parents, um, then this is what you do, right? And it was like kind of creating this, like, this is, we follow the leader. This is what the government tells you to do. You follow it. And then the pandemic happened. So anyways, 2019, I'm having this conversation with my personal trainer who does not have children. And I'm telling her about what's going on with the politics. And, I was down in, Trenton fighting for the religious exemption to not be removed for the state of New Jersey. RFK Jr. was there. And she's just like, oh, this is not going to ever impact me as an adult. She's kind of had that mentality. She's like, I get it. It's a big deal. You're a mom and I'm not a mom. And so this isn't really relevant to my life. And I'm like, no, this is relevant because this is setting the stage for controlling everybody, children and adults. And sure enough, that's what happened with the pandemic. And she was not able to train people in gyms without getting her COVID vaccine, right?
Mhm.
And this is somebody who's extremely healthy and health conscious and had no desire to get the COVID vaccine. And here she's complying because it was instrumental for her employment. So this is a real thing. And as I think as citizens, we need to speak up. We need to really protect personal medical freedom. It's a big deal.
Yeah, I think it's a huge deal, and we saw that during the pandemic, and it's going to happen again, and it's going to keep happening because there's a lot of money behind it, and all you need to do is get things rolling, have people afraid, and provide them a solution. And if you are allowed to make it forced, then why would pharma companies who have all the money in the world not try to push a narrative that creates a situation where um, something would be forced so they can make a lot of money from their product? I mean, they obviously have every incentive to do that. It's not necessarily nefarious. I mean, I'm sure there are parts of it that are, but it's just logical, common sense. If you're a company, you want to make a lot of money from a product, you want that product to be uh, essential and needed and forced if you could be. I mean, if it's forced, then everyone's got to take it. So it's a lot of money there. And so I think our role needs to be to say, look, make your products. All pharma is not bad. There are lots of things that can save your life, but we just don't want it to be forced. And the more that we can retain medical freedom and just say, look, new product comes out, a new situation, we still have to have choice, then I think we're going to be okay. And look, if there's some horrible disease, like let's say Ebola is going around and 9 out of 10 people are dying, you are not going to need to force people to get a vaccine or a product. They're going to be lined up
Right.
eating each other and murdering each other to get this because they
Right.
feel they're about. You don't need to force it. Like if there's some sort of real horrible I mean, obviously COVID, was not great, but it wasn't like killing 9 out of 10 people, right? If
Correct.
there's some horrible disease where basically everybody's dying and there's some product that could save you, even if it had a high risk from that product, people would be lining up and pushing each other to get it. So you don't need to force it in those kind of situations. And if a situation, even like something like COVID, where it's a small risk of death, it was there, but still pretty small. And serious disease was serious, but not like everybody was. Most people did fine, and so there's no real need to force that. People should have been able to choose if they wanted to get it, and that's that. And if you make the wrong choice, yeah, you could get sick and die. That's possible. But ultimately, even in that scenario, there was no need to force it. It should have just been available. And I think, and I hope that we will learn some lessons, but I don't know.
Yeah. Well, once again, I think that's why it's so important to get in front of parents, educate parents. I'm sure some of your favorite parents in your practice are the ones that have done the research and are really walking into that office visit prepared because they are understanding that this is important to learn as much about this for their child's health and not expecting the doctor to give them all the information, right? Like you're there to have a dialogue because they've been informed and have done their own research.
Yeah, and that's really the reason why I wrote the book Between a Shot and a Hard Place, because I was hopeful that I could create something that's a little bit more balanced than what's out there. Most things are pretty pro-vax or anti-vax when you read a book, and I want something that's more in the middle, so that way a parent who's thinking about vaccinating, who has questions about vaccines, could understand the landscape, understand the benefits of vaccines, the risks of vaccines, the controversies, the questions. It's not telling you what to do, but it is providing you a nice landscape of what's going on, and then hopefully you are more educated, that can help you to ask the right questions, to have a better discussion with your practitioner, or to be a nice launch pad for reading other things, looking into other things. It's not going to get you to say, oh, vaccines are the worst thing ever, and you're never going to look at vaccines, but it's also not going to say that vaccines are the best thing ever. And I think that's where most parents are.
Yeah.
I don't think that most parents are really strongly pro-vax or really strongly anti-vax. Most people just want a healthy kid, and they're very confused because everyone's giving them different messages. And so I think a balanced approach is what most people are looking for, and they want information to help them to navigate this crazy world where even to today, like, our major organizations just don't even agree. CDC, American Academy of Pediatrics, ACIP, HHS, they all disagree with each other about vaccines. So how is a parent supposed to make a decision when our bodies and associations are just fighting with each other, and you get different messages every week? So I think it's a tough time to be a parent in terms of vaccinations, especially. And so the only thing you can really do is to arm yourself with information. And whether it's my book or other books or programs, I do think if you're going to be thinking about vaccines, you need to read. You need to
Yes.
think, very, very pro-vaccine. Read something by Paul Offit. Whatever. Read something very
Mhm.
pro-vaccine. Read something, very not vaccine.
Watch the
Anti-vax.
Vax movie.
Yeah, watch different things and get different
Mhm,
perspectives, and
mhm.
then start to formulate your opinion. But don't just listen to one. Like, don't just watch Vax. That's not
That's
the
not
best way to
complete.
informate about vaccines. Like, I think you need to do different things, and you need to read something. You need to read stuff by the CDC, and you need to read stuff by people that have concerns, and then you can start to formulate and understand both sides. That to me is a happy medium, and that is where you can start to ask real good questions.
Yeah, agreed. I think it is really important to understand the whole picture here, and it is so divided, right, that you're going to have two very extreme perspectives, and so it's great to expose yourself to both, and then you can kind of understand really where it settles for you as a parent. One thing I wanted to ask you about as well is, pediatricians in the American Academy of Pediatrics is definitely, as far as I know, an advocate. An average traditional pediatrician is an advocate for the recommended vaccine schedule. So following the schedule to the T, and typically they're avoiding doing, a delayed schedule, or certainly they will discharge patients if parents choose to not vaccinate. What is your perspective on that, since that seems to be most pediatricians in the United States?
Yeah, I mean, to me, one of the most frustrating things is that doctors won't work with all patients. That they kick you out if you want to do something different. But ultimately, if you are someone that has questions that wants to do something different, then that's probably not the right office for you. If
Right.
they're not even willing to have conversations, and not even willing, let's say, if you want to do a slow schedule, to discuss that with you, I think doctors are quite close-minded when it comes to vaccines, and they have their schedule, and that's what they follow, and they don't want to do anything different, and that's most doctors, but not all. And
Not
and so
all.
I think that what's most important as a parent is you need to acknowledge that. You need to understand that that's a reality. And if you are the type of parent that wants to do something different or has questions, then make sure when you're interviewing pediatricians that you ask those questions. Like, don't shy away from it. If you're thinking about doing a slow schedule or alternate schedule or want to ask questions, just ask them, like, are you okay with that? If they're not going to be okay with it, just don't go there. Go to a place where you can ask questions,
Yeah.
and that way you can feel more comfortable when you're doing it. Because even for me, a lot of families wanna do a slow schedule. That's what they wanna do, and they come here because they know that they're not gonna be made fun of. We're gonna have discussions. If their kid is that kid that has, some serious issues, then we'll maybe go slower, we'll work through it. If their family has lots of issues with vaccines, then I'm not gonna push them to do them all on day 1 just by the schedule, and, I think that's important. So I think you wanna find someone that's gonna work with you, and your decision may ultimately be to follow the CDC schedule, but I think if you're gonna want to have questions, then you should go to a practice where they're at least open to having those discussions so you can get as informed consent as you possibly can.
You're right. So ideally, every pediatrician out there would practice like you do. I want to speak to like what is the culture in medical school and maybe influence from big pharma that, and also the Academy of Pediatrics that's created this, if you don't vaccinate, you can't be a patient in my practice mentality.
I just think most doctors don't really think about it. I think they think that vaccines are the
They're
best
just
thing.
not questioning it. Okay. Well,
It's
so
it's
that's to me like part of the training,
Yeah,
correct?
well, it is part of the training. I think that you are taught. I mean, you're not taught a lot about vaccines, and you don't realize that until you kind of think about it after. You're mostly taught about what the schedule is, what the horrible diseases are, how much better they are, how great vaccines are. Here's your schedule, go do it. And anybody that is questioning it's kind of a crazy anti-vax kook, and you don't really learn about the risks. You don't really learn about the concerns. You don't really have discussions around vaccine hesitancy or why people might have concerns. So you just kind of are taught vaccines are the best thing ever, and you just go do it. You don't really question it. And to have vaccine discussions takes a long time, and for most doctors, they don't have a lot of time, and so they're not really interested in even doing that or spending the time to look into it, to do the research, to think about vaccines, to potentially even think that there could be problems because they're just giving it to every kid. So I think for the most part, most doctors are pretty close-minded to even having thoughts or conversations around potential risks for vaccines. And so it's just easier. And the culture is just that vaccines are kind of put on a pedestal and everybody should get vaccines or we're just all going to die. And I just think that's kind of where we are. Like, we're just at this place where vaccines are just this magical thing. And it's changing a little bit. I mean, certainly there are more and more people that are, more and more doctors that are open to having discussions. And it's certainly more it's more out there than it ever was with someone like Secretary Kennedy and HHS. Like, you have no choice but to be confronted with some of the concerns these days.
Yeah.
So I think the younger doctors are a little more open to having these discussions in general. But still, most doctors really feel very strongly about vaccines, and so that's what they recommend and they push, and that's their prerogative. I mean, you're allowed to recommend things. You're allowed to kick people out. That's not against the rules. And so if you are someone who thinks differently or wants differently, just don't go to that office. And if everybody stops going to those kind of offices, then doctors will change. They'll change if they have no patients. And that is honestly something that is happening. I mean, there are so many discussions around doctors about in doctors groups about, well, there's so many patients that are asking questions and we're kicking out so many people. Do we need to change our policies? So things are slow, slowly changing. I've seen it. I'm in doctors groups,
Wow.
kind of lurk in some of them, and it's just things have changed. Like, there's more concern around vaccines than there ever was.
Yeah.
So I think you shouldn't feel bad about it. Just ask your questions, decide what you want to do, and go to a practice that's willing to have discussions. That's all.
Yeah, and I think the bottom line here is whether it's, a prenatal visit, to your OBGYN or it's you're interviewing for a pediatrician before you give birth, you want to be, it's an interview, right? You are interviewing for the correct provider for yourself. And if that provider isn't feeling like the right fit, then you move on to the next person, right? And there's no hard feelings with that. It's just really finding who is going to be the best person to serve in this healthcare role for myself and for my family. And asking these questions is really important. And if you're feeling bullied, which I have heard stories about, then that's a red flag that provider is not the right fit for you.
Yeah, I agree, and it goes both ways. I mean, there are many families and parents that are strong believers in vaccines and would never want to go to an office where there's an unvaccinated kid. So then you want to ask those questions too. You don't want to go to an office where the doctor is going to have lots of unvaccinated kids. So that's fine. Like that's
Mm.
called choice. That's informed consent. You're supposed to have those options. I don't have any problem with that. I wish people would be a little more open to choice, or at least having discussions. But ultimately, it's not. You're allowed. Ultimately, you're allowed to do that. And so I think it goes both ways. And for parents who are listening to this, who are probably more holistic minded, just find a doctor that's more open to it. There certainly are lots of doctors that are at least open to slow schedules, and you won't know unless you ask. And you don't want to be somewhere and then they kick you out. Like you can find that out pretty quickly. It's usually on their website. If you ask them like one question, they'll probably be like, "No, no, 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 you're not the right fit for us." Right? If you're like, "Well, we don't want to vaccinate or we want to go slow," they're gonna be like, "Well, we don't do that here." They'll
Right.
let you know right away. They're not gonna be shy about it, and you don't want to be somewhere that they don't want you, and the doctor is fully happy to not have you as a patient if that's their stance. And there are plenty of doctors out there, so don't feel bad about it. The doctors that want everybody to be vaccinated in their practice, that's what they want. So they're not going to be unhappy if you don't go there. So don't worry about it.
Right. Right. And that last statement you mentioned too, like a family who's like, I don't want to go to a practice where there might be unvaccinated children in the waiting room. Like, well, isn't the vaccine for your child supposed to protect them from, quote unquote diseases? I guess if you're talking about a baby who has not received their vaccine yet, maybe that's their concern. But right, like when people are like, oh, I don't want to go see that person because they didn't get their vaccines. It's like, well, but if you have it, then you're protected.
Yeah, I mean, they're those are long arguments and discussions, but I think ultimately the biggest factor there would be I have a newborn. I'm worried that there are a bunch of older kids that don't have vaccines. My kid's going to pick up something they wouldn't get at a different place where the kids had vaccines. And that's real. I think that is there is a real argument there. It's a small risk, but it is there. I think for sure something like measles. The more kids that are unvaccinated for measles, the more chance you could walk into a waiting room and somebody has measles. I think that's true. So that's something you just have to think about and decide. That's not a small discussion; it's a long discussion, and each disease is kind of different. And you can't lump all vaccine diseases into one. But
Right.
that ultimately, I think, is the reason. In general, it's not so much that your vaccine should work. I mean that's true, right? And I think there's like a lot of argument around that when it comes to school, where it's like, well, if you have your vaccines, I don't know why you're so worried. But then they're like, well, they're the kid that can't get vaccines. So there's a long discussion maybe for another day, but ultimately you have to decide what's right for you. And if you're so worried about the unvaccinated kids, then maybe don't go to the office where
Yeah.
a lot of unvaccinated kids, but those offices are few and far between.
Right. Right.
Yeah.
Fortunately. Well, Dr. Gator, this was fantastic. I really enjoyed our conversation. I really don't want it to stop, but I know we have to be respectful of your time. Did you have any last thoughts that you wanted to share with the audience?
I
Maybe
think,
to talk about your Substack?
are you sure? I mean, I guess just to start, don't feel bad or crazy if you have questions about vaccines. I think a good parent has questions. It doesn't mean you shouldn't do it or you should do it. I just think that if you have questions about injecting something 20 plus times into your kids, that's totally reasonable, and that's why you should get educated and you should ask questions and you shouldn't feel bad if you have concerns. You should have concerns and you should discuss those concerns so you can feel comfortable to do it if you're going to do it. And so that's again one of the reasons why I wrote my book, and I've kind of continued that on through Substack, which is doing wonderfully. It's surprisingly how popular it is. It's usually pretty consistent in the top 20 Substacks, also called Between a Shot and a Hard Place, because I think people are interested in vaccine information, not just vaccine information. I do parenting stuff too, but
Yeah, it's
a lot,
excellent. I
a lot.
absolutely love your Substack.
And thank you. And I think that that's the best way to kind of keep things moving forward. I mean, a book's good and it gives you a good landscape, but something like a Substack is more almost like news, where you can kind of keep up to date on what's going on. And with vaccines, especially, things are changing so rapidly. So that's what I try to do there. So both the book and the Substack are called Between a Shot and a Hard Place.
And then also people can find you on Instagram as well.
Yeah, Instagram's fun, at Dr. Joel Gator. And obviously, you can't spend as much time explaining something on Instagram, but it's good to get kind of snippets and fun things. And I try to ask a lot of questions and be thought provoking in there.
Yes. Well, I appreciate you and I appreciate what you're doing and getting this information out to parents and really helping us feel informed and especially with this ongoing political changes and laws that are continuing to evolve. Like it's great to just have somebody as a quality resource like yourself.
Oh, thank you.
Thank you. Well, I hope you enjoyed today's show, and definitely make sure to check out Dr. Joel's website at integrativepediatrics.com. You can follow him on Instagram at Dr. Joel Gator, or also definitely check out his Substack. I love it. Additionally, if you need help, extra support, and guidance with your own personal journey, I am here to help. As an IFM trained functional medicine practitioner with over 20 years of experience, I'm now offering virtual functional medicine consultations, specializing in preconception, fertility, and women's health. Please go to my website at drlaurabrayton.com, click Become a Patient to schedule a complimentary 15-minute discovery call with me to see if my program is the right fit for you. And if you love this show, leave us a review. Go to ratethispodcast.com/well-adjusted mama and follow the simple instructions.